orientation. My name is Emily McCreary. I am going to be taking you through the finer points of becoming a Pacific Point employee. So we've got Justin on our meeting today. He's joining the team as a PTA for our home health department. And then I'm going to be sharing this recording with a couple others who are joining the team this week in early April 2025. We've got some people who are joining the hospice team. And then we've got some people, a wide variety of disciplines. So we've got a social worker, we've got an occupational therapist, we've got a nurse, we've got an LVN, an RN and LVN, and then we've got Justin, who's representing the physical therapy team. So a widespread, diverse group of people joining us this week, which I love. So we're going to go through my little slideshow here. So let me advance to the next slide. And for that. Okay, so here's just a little representation of all the diverse people that we've got coming on our team and all the people that you're going to be working with as you become a Pacific Point employee. I know oftentimes in this industry, we've got people joining us in a per diem capacity or a part-time capacity. And that's really typical for this industry and home health and hospice too, where we've got, a census that shrinks and grows all the time. And so our staff that we have to support all our patients, it needs to be flexible and nimble. So we do a lot of per diem, part-time hiring so that we have a staff that is flexible. There's a lot of people that like to work and we want to give you a lot of work. And then sometimes we're slow and maybe that means that you get to have a couple of days off and go on vacation. Or just kind of pick up work with another agency. So some of the faces that you see here may be familiar. You may work with them in another agency in another capacity. And so we want you to know that that's okay. But we also just want to make sure that it's clear that we do expect that you'll keep patient information private based on the agency that you're representing. So anything that you're doing for Pacific Point should be kept confidential and secure within the Pacific Point Microsoft bubble on Teams and email. And any documentation that you have regarding patients needs to be kept secure for HIPAA reasons. Alrighty, so this is your team here for HR and recruiting. So many of you talked with Jessica Sperry. She's our senior recruiter here at Pacific Point. She's lovely. She brings us all of the best colleagues to work with. And she is a big part of our team here in the office. And then myself, Emily McCreary, I'm the HR generalist. I'm also, I wear a lot of little hats in addition to HR. I do payroll. I kind of the de facto IT person. I sit up close to the front, so I kind of end up being the receptionist for guests when they come in. So I have kind of a lot of broad responsibilities, but my main thing is I want to take care of all of my employees and be a good resource for you to come to as you're finding your way in the Pacific Point world here. A lot of times I may know the answer to your question, but if I don't know the answer, I will find out and I will make sure that we get you connected up with someone who does know the answer. So think of me as the librarian of the company. So we're going to go through some basic stuff this morning. We got our mission and vision. We've got our just kind of a quick overview of the company structure. We're going to talk about safety, workplace violence prevention, infection control. We'll quickly go through emergency preparedness, talk about communication, and hit on HIPAA. And many of the things that we see here on this little bullet point list are going to be touched on today in this orientation, and then you'll have follow-up training a little bit more in depth, which will be assigned to you in Relias, which is our electronic training system. So you'll have like multiple touch points on all these topics here. So first and foremost, this is our mission and vision. We are a healthcare company, guided by a tradition of personal, clinical, and innovative excellence. We want to provide the highest quality patient care with compassion and respect for each person. And I like to think of this as, of course we are. Any healthcare company would be doing these things. So we want to make sure that we stand out in the sea of people who do the same work that we do. We're not the only company in San Diego County that provides home health and hospice care. So what we can do to make ourselves stand out is to really hone in on your personal superpower. You see these little icons here. We've got little different elements that kind of I pull out of the mission and vision. So obviously we want to be overall excellent. So being, efficient and providing good quality care, communicating clearly with your patients is overall just a sign of excellence. We want to make sure that we're focusing on our patients because we are providing healthcare. We want to make sure that their needs are being met and that their expectations um, are are not just met but also exceeded. We want to make sure that we're leaning into technology and the ways that that can help us to innovate to make things go a little faster. Organizing your day, doing your scheduling, use those tools online to help you coordinate yourself. Um, we also very much want to focus on the culture of safety and quality. For me, as your new HR mom, I think of you guys a lot of times as my patient. That you know that it is not just my job, but it's literally a passion of mine to make sure that my colleagues are safe and happy. And so we'll talk about this more in a minute, but proceeding with caution at every step is important. And if something isn't feeling safe to you, I want you to know that you can reach out to me and let me know about it. We'll discuss it. We'll figure out a way to solve it. And I just don't want anyone to feel like they should be having to work in an unsafe environment. It's literally the law for me to make sure that you do have a safe working environment. So, if anything that you take away today, I want you to remember me saying this to you. I want you to be safe. I want the patients to be safe. And I just want everyone to be generally safe and happy. Um, and the last bit here with the little heart, the compassionate healthcare, I lean on this one a lot too. I am not a nurse or a clinician or a practitioner by any stretch, but I do feel a very strong desire to take care of people, and I think that's why I fell into this role in HR. So I literally will take care of you as my colleagues and employees, and I also want that to cascade out into the patients that we see. And that's where you come in as clinicians on our team, therapy, social workers, nurses, um, anyone who's talking to the patients directly. I want you to feel loved and supported by me in the office and from all of us here in the office staff. And then I hope and wish that that love and support that you get from us, you're able to cascade that out into your care when you're talking and helping our patients. So that's the thing that I think that probably sets us apart the most from other agencies in the county and that do the same thing that we do. And I guess hope personally that you take this away from the bottom of my heart as your HR person at Pacific Point, that you'll be taken care of here, you'll be respected, and that will let you be able to provide those things to our patients too, respect and care and just safetyness. I'm long-winded, I'm sorry, but I think that's an important slide to hit on there. So the structure of Pacific Point, I like to think of the company as kind of a tree. We have a couple of branches. We have a home health branch, which is where we provide nursing, physical therapy, occupational speech therapy, social worker services. Sometimes dietitians get involved, and we also have home health aid services. Um, for reference, right now in April 2025, our census for the home health department is roughly 240 patients. And then our other branch, the hospice branch, does nursing, social services, home health aid services, also provides spiritual services, volunteers, and bereavement services for those patients when they do pass. Um, the census for our hospice branch right now is we are at 41 patients. So it's quite a bit different size wise. The home health branch is much, much larger than the hospice branch. Um, and we don't really have um, people that kind of bounce between the two branches, although it does happen. There's a social worker that's seeing patients on both home health and hospice. And you have the support staff like myself who does support both branches. I like to say I live on the tree trunk, whereas you guys are up in the branches of the tree. um, so many things are similar between the two branches, but there are some pretty big differences a lot of times in the way that the care is provided. But the nice thing is when you have a patient who comes to us as a home health patient, um, sometimes their particular condition may turn into something that is not going to be curable. And so they may be looking into hospice services as they transition. And that's nice because we can provide those services for them. And it won't be as much of a disruption if they were to go from our home health agency to a different hospice. We have a nice transition team. So kind of an all-in-one kind of product there for our patients who need us. We are the type of agency that provides care for the patients wherever they are. So they're a lot of times in their own homes, in a boarding care facility, an assisted living facility, and sometimes in a skilled nursing facility. So we are going to them. We do not have a freestanding location where they come in to see us. We are always going to go to the patients. All right, we're going to talk a little bit more about that safe work environment. As I was saying earlier, this is a personal passion of mine, but it's also a law. There's regulations around this. So it's important for you to know as an employee what your rights are. Um, when we have patients who come on service with us, we have them sign an agreement. That's part of the consents for them to become a patient of ours. We are making an agreement with them that we will provide quality care and meet all the standards and expectations that are put upon us by Medicare and our accrediting bodies through the Joint Commission. They're also agreeing to provide a safe work environment for you. Um, and that includes a couple different things. It could be a pet, making sure that their pets are securely confined, making sure that any weapons are stored away, that they don't smoke, and that if there's other things going on in the house that you notice when you're there that you think are causing an unsafe situation, please report it to me and please get yourself out of that situation. If you really feel unsafe, I want you to, um, excuse yourself from the visit and then get to a safe location and call and report to me in HR. You can also report to your manager. If it's very severe, you may need to call the police and, we may need to get APS involved. But the most important for you to know is you are not expected to risk your life to take care of our patients. Yes, we care about our patients and they are important, but you are more important to me as an employee. You are more precious to me than our patients. I hate to say that, but I want you to be safe. So please take that. As I said, take that with you when you end this training with me today. I want you to remember Emily wants me to be safe. Emily wants me to tell her if sometimes something doesn't seem safe. Um, it's literally your right as an employee. Um, and then in addition to, rights and responsibilities agreement, there's laws with OSHA regulating just workplace safety in general. That's kind of my world that I live in all day as an HR person. So making sure that any workplace violence is recognized and reported and swiftly dealt with. Um, we will not have that. We will not have those sorts of things in the workplace here. So if you have something going on, let me know so that we can work on it. Part of your training in Relias will hit on this a little bit more. There's a way to report any kind of instances of workplace violence, and managers are also trained in how to receive those kinds of reports so that we can address them and resolve them. Okay. The more basic OSHA safety protocol. When you're out there seeing patients, you're in a situation where a patient is not well and they may have, infections or something. So we need to make sure that you are taking extra precautions to make sure that you are safe. Always, always wear the appropriate personal protective equipment. So whether that's a mask, face protection, eye protection, certainly always gloves, and using a barrier between your items, your nursing bag or your supplies bag. Place a barrier down on the table or on the surface that you set your items on so that you do not contaminate your bag with the patient's home environment. Always mind the wet and dry times of any disinfecting product. This is something I learned not that long ago. When a surveyor came through, you got to make sure that you're keeping that item or whatever it is that you're disinfecting, keeping it wet for the appropriate amount of time. Like read the directions on the bottle or on the container of that disinfecting product. Make sure you know what the wet time is so that you know how long to keep it wet. And then make sure you know what the dry time is so that you know how long it is before that item is considered to be disinfected. Um, And really, it just comes down to common sense. Assume everything is gross and infected and needs to be cleaned if you're not sure. So when in doubt, go ahead and disinfect. Part of your job is going to be understanding the level of exposure that you have when it comes to bloodborne pathogens. So, in the healthcare industry, we all have some level of exposure. Myself here in the office, I really don't expect to come into contact with any kind of bodily fluids or blood, although it's not 0%. There's a chance someone could hurt themselves in the kitchen or, fall down and cut themselves, whatever it is. So, it's a low risk. It says none here on the slide, but I don't consider it to be none. I think it's just very low. Then we've got the next group here with the some category. So that includes our physical therapist, occupational therapist, speech, medical social worker, spiritual counselor, and the medical director. You'll have some exposure, and that just means you're in the home or the vicinity of the patient, but you're not hands-on taking care of a wound or changing bandages. You are exposed, but you aren't quite as exposed as the last category here, which is the clinical directors, clinical supervisor, QA coordinators, RNs, LVNs, home health aides who are up close and personal with our patients, doing wound care, doing bandage checks, doing personal hygiene care, bed baths, showers, really close to the patients, taking vitals, doing all the things where you really have a high risk of bloodborne pathogen exposure. And just is super important to make sure that you're wearing that PPE when you're doing those work tasks. I'm going to quickly talk about HIV as part of the bloodborne pathogen kind of portion of orientation. So there is HIV is still a thing out there. Has been a lot of advancements in treatment of patients who have HIV positive. Um, and the way that we're going to talk about it right now is just when it comes to the risk of exposure to HIV as a healthcare worker. It is very rare to actually contract HIV as an instance of healthcare worker exposure during the workplace. So like a needle stick or a splash. Um, it's pretty rare. So you can see the stats down there. There's been only one confirmed case since 1999. This is a little bit of an older set of data. I haven't found anything updated more recently than 2013. But the amount of fluid that it would take to give you enough to kind of contaminate your immune system is pretty high. And having a small needle prick or a small splash come into contact with you as a patient or as a clinician with an open mucous membrane, you would need quite a bit. So it's possible, but it's not probable. So this is comforting to know, but still it's important to know that there is a risk. I mean, there's HIV, there's a lot of other germs and diseases out there, but HIV is one that the Joint Commission um, wants us to highlight during orientations like these. So the best way to prevent yourself from getting HIV as a result of a workplace exposure is to use your gloves and goggles and barriers, wash your hands, make sure you're very careful when handling any kind of sharps. Um, if you are a nurse and you're doing blood draws, you will be issued a sharps container for safe disposal. The patients should have a sharps disposal in their home. Use the safety devices to prevent those needle stick injuries. Many of those needles come with certain mechanisms to keep yourself safe. And then make sure that you're disposing of any syringes in a sharps container in the appropriate methods. What happens if you get hurt on the job? So anytime you hurt yourself, please let me know. Even if you don't think you need to go to the doctor, I still want to know about it. And the reasoning is if, it's not a big deal at the moment, you kind of walk it off and you feel fine for the rest of your shift, that's great. But what if you wake up the next morning and I don't know, your ankle is swollen and now you're unable to put weight on it. And then you call me and you say like, yeah, I hurt myself yesterday doing blah, blah, blah. And then I have to now be a little bit suspicious of what happened and why you didn't tell me about it right away. Um, it's best practice to just give me a quick text or a quick Teams message to let me know what happened, where you were, how it happened. And then that way I have a note about it. And hopefully we don't need to do anything further. But in those rare circumstances where it does develop into something, more, maybe it's a cut that becomes infected or, a back sprain that just becomes way more painful than you initially had. thought it was going to be. Or like I said, your ankle, maybe you rolled your ankle while you were walking up the steps to a patient's home and it seems okay, but then the next morning, like I said, it's swollen and you can't put weight on it. So always best to report it to me and hope for the best that you won't need to have follow-up, but that way I have it noted and I can provide um, a good record to our workers' comp um, department when I do process that claim. So always let me know. And then we'll start out, like I said, this little visual down here on the bottom of the slide, you'll start out happy, calling, let me know, like, yeah, I hurt myself. I will take the note, put it into a record. If you need to be seen by a doctor, I'll set that up, and then you'll feel better. The smiley face on the end. We do have an influenza program policy here. We like to make sure that everyone gets an annual flu shot. You're working in the healthcare industry. This shouldn't be a new topic or a new idea. Most of our fellow companies that provide medical care do this similar thing. This is something that Medicare encourages all of the companies that it pays to do. So we will provide flu shots here at the office if you don't have one for the season. And now that it's April, we are technically outside of the flu season. So we'll start talking about this a lot more in September. If you get a flu shot at your doctor's office or the pharmacy, please send me a copy of that so I can put it into your file. I have to report on the percentage of our staff that does get flu shots every season and those that do decline or have an exemption. So I like to have something in my file for everyone on the flu program. If you opt out of the flu shot, that's fine. I just need to have something on file to show that you are choosing not to get the flu shots. All right. And tuberculosis, this is just a little flow chart about the TB tuberculosis test process. So I think most of you on the call who are participating in this orientation have already provided your TB records to me or have gotten a TB skin test recently. That's awesome. If you get TB skin tests, we do that every year. We want to make sure that we keep an eye on that because TB is so infectious in the community. We don't want anyone to have an outbreak. We don't want to share that disease with anyone because it is pretty contagious. If you've had a BCG vaccine as a child, if you grew up in another country, it's pretty common for people to have a BCG vaccine that can cause a false positive on the skin test. So we ask you to get the chest x-ray every 5 years. And if you've got that, that's awesome. You can send me a copy. I will put it in your file and I put an expiration date on it with a little tickler reminder so that it'll send out a notification to you to let you know, oh, it's been 5 years, time to go get another x-ray. We will set that up for you through Concentra. You can also get that done at your doctor's office if you prefer. I just need to get a copy of that and put it in your file. If you would prefer to get a TB blood test instead of the chest x-ray or the skin test, you can. That is acceptable. However, Pacific Point will not pay for that test. We will only pay for a skin test or a chest x-ray. All right, quickly talk about the emergency preparedness and response plan. So everyone needs to know their role in the event of an emergency. You'll have follow-up training about this in Relias, but this is something that we all have to go through annually to talk about emergency preparedness. So make sure as a clinician, you know your patients should have emergency plans as part of their start of care. If they have an evacuation order for wildfire or some other emergency, we need to know what their plan is, where they're going to go, knowing what level of patient they are, if they have oxygen or if they have some sort of electronic device that they need in order to sustain life. We need to make sure that we know about that and we can assist them with a higher priority compared to some other patients who maybe don't have that. And communicating with them to make sure that they're aware of evacuation orders in the event of a fire or some other emergency is a really important step. If we have something going on in the corporate office, we need to make sure that the staff here in the office knows how to evacuate the building safely and meet up at the designated waiting place, which I'm going to show you in just a minute. And then mostly the managers are going to be bearing the heavy lifting on any kind of workplace emergency, kind of keeping in touch with everyone on their staff, making sure that the phone tree is activated and we are verifying safety of all of our staff and their patients who are in the area that is affected by the emergency. This is a map of our office and the escape route that we would like everyone to take. The staircase um, that is to the north end of the building is the closest one to our exits. They're indicated in the pink stars. So you would leave the office via one of those doorways there indicated with the pink star, go down the stairs, across the courtyard, and out into the visitor parking area, which is on the west side of the building. That is where a fire truck would pull up if there were a fire. That is where ambulances would come up. So that's the best place to be if we need to have some sort of medical treatment or triage happened. So we'll meet there, we'll count heads, and we'll make sure that we have everyone accounted for. Alrighty. As a new Pacific Point employee, I'm going to issue you an ID badge. It's important that you wear your badge when you are out seeing patients. It represents the company, and it makes us, seem more professional. It's important to identify yourself when you're going into a home of a patient. Also, if you're into a facility, they really it's best to wear a badge because that they know who you are, they know what you're there to do, they know what your role is, and if they have any questions or if they have any issues, they will know who to call. So please be on your best behavior when you're in a facility. It's important to follow their rules and regulations. They have a lot of different, similar, but some different regulations when it comes to their state accreditation needs. And so a lot of that is important for us to think of as a partner in keeping them compliant with their own policies. So signing into their visitor book, making sure that you're doing paperwork if they ask you to do their own special paperwork for a patient that is residing in their facility. Make sure you're wearing a mask if they ask you to, following proper protocols that they might give you. If you're going into a facility for the first time, not a bad idea to check in with the front desk person and just introduce yourself. Make sure that you ask, what the standards are so that you can familiarize yourself with any processes that they have that are unique. Okay, communication flow. This is what I like to talk about to make sure that you as new employees and clinicians here at Pacific Point who are talking with patients a lot, um, we want and we expect that the patients will call the office for any questions or concerns that they have. We like to be the buffer in between you and the patients when it comes to questions or concerns. We don't want them to just have unfettered access to you directly. So I want you to know that if the patients call here asking to talk with with you as their nurse or their therapist, we will not give out your phone number. We want to maintain that work-life balance for you. We want you to be able to um, establish boundaries with patients so that you aren't receiving phone calls all day and all night. If you choose to share your cell phone number with a patient, that is okay. I just want you to know that you get to make that decision on who you're giving your phone number to. We will never give your phone number out to a patient or a family member of a patient. Most of the time when we get phone calls from patients here in the office, the question is usually, my therapist said he's coming, but I can't remember what time he said or what day. Can you have him call me or can I talk to him? So most of the time we will take a quick message and send a Teams chat to you as a clinician. And then that way you get it on your phone. You can look at it in between patients and make a phone call if you need to. Um, but we don't want to interrupt your day with small questions like that. We'd like to try to keep it to a minimum. So if it's something that we can answer here in office, we certainly will. But that is the typical flow. When you are assigned a patient, like a new start of care, or you've been assigned to a new case, we want you to coordinate with the patient on the dates and times that you will have your visits with the patients. We do not set the times of your visits. Bianca and Olivia here in the office will assign patients to you in Kinzer WellSky. They'll plot it to you in your hotbox, and you have the ability to move that visit within the Medicare work week. You can change the date of the visit when you go to chart on it. You can change the date from the date that is plotted to another date, but make sure that you're communicating that information to the patient and the caregivers or the family members of whoever the patient is staying with. There's some importance to have a conversation with the family the first time that you go out to see them and let them know what your typical styling is when you make your schedule. Like some patient or some clinicians will sit down on on Fridays and look at their next upcoming week and plot everything out, make phone calls and kind of coordinate with their families and patients. Um, and then it's good practice to also call them the day before or the night before, and then even make another phone call when you're heading over to their house. Because sometimes we know in this industry, patients may have a change in condition and they may end up going to the hospital unexpectedly. And if you don't confirm before going over to their house, they might not be there. You might not be able to complete that visit. So, always best to double, triple check and communicate with the families when you're heading out to go make a visit. Alrighty, protected health information and confidentiality agreement. So we are a healthcare company, and we are obligated to abide by the privacy regulations and keep our patients' information confidential. It's uh, it's expected. It's the norm in the industry, and it's something that we must follow. We cannot legally we cannot allow any kind of breaches in security when it comes to protected health information. So make sure that you're using a password protected system when you're working with patient information, um, which includes using Teams or Microsoft account email. Do not send patient information from your personal email account. Do not text patient information on a standard text message. It is not allowed. If I find out it's happening, I will talk to you about it, and we will make sure that we do not do that anymore. It's not acceptable to have conversations about patient information in an unsecured platform. Okay, I'm going to pause here and check to see if anyone has any questions. I'm gonna pause. I'm gonna stop sharing my screen. I'm gonna pause the recording here.